All right, welcome everybody who was just at the Friday Huddle. If you missed the Friday Huddle, it was a good one. It was a good one. If you came to the Friday Huddle and then you jumped into this, smart. There's really good stuff that's going to be happening here. Welcome everybody. This is our extended cut where we're going to be talking about the Healthcare Workforce Index. I'm going to just turn it immediately over to our research director, Rick Allgeier, who's going to describe a little bit about the Healthcare Workforce Index and what it is. So, Rick, take it away.
Thanks. Thanks, Jan. I appreciate it. Welcome, everyone, and thanks for coming to this extended cut so we can talk about the report we released in October. Late October, I think, is when we put it out. But we wanted to let it sit out there for a little bit before we started talking about it. So one of the things that we've noticed over time is as we look at the nursing workforce, we can't really look at it in a vacuum. It's really hard to understand how the workforce operates. It's a dynamic system, and it's a system. It isn't just an occupation, it's a system of occupations, and they interact with each other. Those interactions differ somewhat depending on where you're working. If you're in long-term care, you probably will see more LPNs. If you are in hospitals, you'll probably see more CNAs than otherwise. And also what we noticed, and especially was true during the pandemic, that when things happened in one occupation, nurses often felt the downstream effects of those. So if nursing assistants, medical assistants, all those folks or respiratory therapists aren't around, those jobs often fell upon nurses. Especially during the pandemic. And we're hearing stories that it's still true today. So it's really a good idea to look at the healthcare occupations as a constellation and see how they interact with each other. And that's really one of the reasons we put together this index is so we could get an idea of how they are interacting in terms of some of the metrics looking at labor market pressures. So what is this? So basically, this is a multi-metric tool to look at um, different labor market pressures on different occupations. This is not a ranking tool. This rank is not based on value. It's not based on importance. It's based on how different occupations are experiencing labor market pressures. To measure that, we looked at four different measures. We looked at growth, which is basically year-to-year growth. We looked at it over a 10-year period of time. We looked at shortage, which is basically a ratio of how many job openings are there compared to the workforce, turnover, and also wage structure. We're looking at all of those things. Again, I mean, I'm going to say this a couple times because I want it to be crystal clear. This is not ranking importance. This is just examining labor market pressures on those occupations and how they compare to each other. Um, the other thing I want to mention is all of these data, this index was based on publicly available data. All of the data we use for this analysis are available at the Oregon Employment Department. If you go into their quality data section and you look at they have the occupation projections from 2023 to 2020 to 2033. Those should be released. OED usually updates that sometime in December. We're still a little early. Last year they updated on the 17th of December. It's not quite there yet. So I expect that to come out fairly soon. But anyway, these data are all based on excuse me, these data are all based on publicly available data that you can go out and replicate and look at. There's occupations we did not include. You can go look at those too. So what did we find? Um, we found that RNs are under significant labor market pressure, but they're not alone. Some other occupations are looking at, and even some of the top ranked professions or occupations are facing some labor market pressures. Registered nurses, they rank 16th out of 55 in terms of labor market pressure. Um, They have it's basically a mid-range. There's high turnover, moderate shortages, and high projected demand. So those things coming together um, put it basically right somewhere in the middle of the thing. Um, we did, when I did the analysis, I did try to standardize everything so everything's based on a rate rather than absolute numbers. So one of the things that I noticed was it nursing RNs ranked really low, ranked 8 on growth. And that's a little misleading because in reality, nurses are growing very quickly. We are adding, for the past 3 years, we've added more than 10,000 registered nurses are obtaining their licenses over the past 3 years. The reason the ranking's low is because it was turned into a rate, because it's a big number. Because it's a big number, it just the rate is just smaller just because of the volume of the people coming in. Advanced practice roles ranked fairly low, fairly they ranked high on our list with low rankings, which means there's less pressure on them. But what's interesting is that's not necessarily consistent across all different metrics. Nurse practitioners rank really well when you're looking at wages and turnover. Um, they're they have a big shortage though, and that's partly because the growth of the organ of the occupation is growing so fast right now that
Mhm.
the employers just can't keep up with the number that they need. The programs just can't keep up with getting enough nurse practitioners out. So it's still ranked pretty low. Yes,
Rick, would you
Jenna?
mind if I shared my screen and then I can show what the healthcare workforce index is while you're talking about it so people can
Sure.
just take a look at
Yeah,
that? Okay.
that's fine. Yes. But one of the things that we do hear a lot about is support roles. This is the CNAs, this is the medical assistants, and those kinds of folks. Yeah, so here's the ranking. And I'm going to stop there and just go back and just talk about this for just a brief second. So basically, we looked at all four ranks or all four different metrics. Um, and what I ended up doing for the overall score or the overall rank is just summed all the ranks and then ranked the sums. It seemed like a reasonable way of doing it. It's statistically valid and it's fairly easy to understand how we did it. So you can kind of see registered nurses at the 16th overall rank, but you can see that the individual rankings did vary a lot. Like growth was 26, which means it had slow growth. But again, they're adding 10,000 new nurses, or at least 10,000 new nurses every year. The shortage was very small, and that again is consistent with the data that we're seeing. It may not be consistent with your view from the field. If you're a hospital in rural parts of Oregon or a long-term care facility in Oregon, you may have difficulty hiring a registered nurse. It's not because we don't have enough nurses, it's because there's a lot of local factors that impact your ability to recruit. It could be housing. There's a whole lot of things that have nothing to do with the healthcare industry that have serious, major impacts on facilities and organizations' ability to recruit. Um, and you can see that nurse anesthetists, physical therapists, physician assistants, and nurse practitioners all rank. They're all at least the third ranking. They're all really high. A lot of that is because there's very little turnover in those org positions. Wages tend to be pretty high, um, and growth is actually they're growing very fast. So those all give low pressures which makes them rank higher on this. As you can look at the bottom of the list, you'll see a lot of the support roles. And those support roles are really important because they do a lot of the work that allowed RNs to practice at the top of their license. If these folks are not in the workplace or not in the workplace in sufficient numbers, a lot of those tasks fall onto registered nurses because there's no one else to do them. And so what that causes is it causes registered nurses to be more task oriented. It also causes them not to be able to practice at the top of their license. So these, and I'm going to let Dawn talk about this in just a minute, but these let the nurse practice at the top of their thing. And it also maintains their ability to it 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 really helps stabilize the occupation so to lessen burnout, which also reduces turnover. So with that, I'm going to turn it over to Dawn so she can talk about a little bit to you about some of the practical aspects that we've seen over the past couple in the research that we've been doing in the field over the past couple of years. You're on mute, Dawn.
End of the year, you forget a few things.
Oh, yeah.
Um,
And the buttons seem to move on you
it
too.
does, it moves. Thanks, Rick. Hello, everybody. I'm really excited for this table for a few reasons. Over the years, we've done various different projects. The Barriers Project, where we went out to rural Oregon locations, talking with different facilities and different practice settings. And then also the Arm Wellbeing Project, where we've done the same throughout the state. And this shows up. This shows up almost in every conversation. When we were in Coos Bay, for instance, we were talking to some of the long-term care folks there, and the need really was for med techs in long-term care. And without the assignment of med techs, the burden shifted to the nurses. And so when you don't have that support staff, as Rick indicated, that's the practicality of the work burden transference going into nurses' roles rather than being spread apart so that nurses can be relieved to do other things. And we saw it too in well-being surveys, right? When we did the survey in 2022, we also redid the survey here in 2025. But the most important things that we were looking for as far as nurses, what they needed was support staff. And this really kind of shows you where that support staff lies, where the pinch points may be, and where the impact may be for nurses. So I just really love that we have this table to now be able to quantify and specify, okay, yeah, there's a problem here, and this is how it impacts nurses.
And keep in mind, it's like if some of these occupations are in low numbers, it increases workload. And workload was one of the biggest stressors that we saw in both of those surveys Dawn talked about.
Yeah.
It was really, really high. And in all of the field work we've been doing, we've been hearing a lot about just the sheer workload that people are facing. Okay, so while there's some practical aspects to how some of the differences in the presence of other occupations in the healthcare environment impact nurses, this table's also really helpful in terms of workforce planning and for some policy implications. And I'm going to let Janice speak on that for a few minutes.
Yeah, thank you. Um, when I have gone through and talked to legislators, policymakers, other workforce planners, a lot of times it always feels the conversation seems to be like, we really need to get registered nurses into the field. And then suddenly it becomes, okay, no, we don't need registered nurses, we need CNAs. And no, we don't need that, we need MAs. And it's kind of like feels like in the conversations from a policy and a structural perspective, it jumps between we need only these people or we need only these people. What is good about this is it kind of just demonstrates where if we keep doing that, we're just playing whack-a-mole. We're writing policies that are just going to be playing whack-a-mole. And if we can start to say, okay, in this particular, if we're looking at this particular table, we can start to understand if you are a registered nurse and you are in a setting that is going to be reliant on certified nursing assistants or medical assistants or even healthcare social workers um, or even phlebotomists for crying out loud, if you're going to be relying on that, if somebody's going to say that you don't have a lot of that, well, of course not. They're not paid. They're on the rankings of how they are paid. They're not paid as well as a nurse anesthetist, obviously, and also their turnover. There's a lot of turnover and it's kind of baked into the system. So if we understand that, if we understand that those support roles are going to be turning over a lot, how can we make sure that we're supporting our nursing workforce by also just understanding that dynamic and understanding how that dynamic is actually impacting the workload of the nurses and that impacts the retention of the nurses, which then impacts the overall statewide nursing shortages that we're talking about. So when we talk about policy, we're really needing to look at things from a regulatory perspective and from a just an overall rules perspective of we need to make sure that we are retaining people throughout the spectrum of all of the workforce, of all of the elements of the healthcare workforce, understand the dynamic of hey, this is a group that is going to be turning over a lot. This is a group that's not going to be turning over a lot. And how can we make sure that we write our policies from a systemic point of view to really take into consideration all of those things? All right, Rick, you want to wrap it
Right.
up and then we'll go to questions. And if you have any questions
Sure.
while we're putting this together, please go ahead and put it in the chat so we don't forget if you just so you don't lose it. And then we can also we'll ask for questions afterwards. So Rick,
Yeah.
go ahead and wrap it
And I
up
just
and then
saw
we'll
I
get
just
to
saw one question that I definitely will deal with at the
yeah,
end.
great.
So I mean, one of the things that this does tell you is that Jen is absolutely right. It's like this takes it, you have to start, if you're doing some workforce planning, you need to look at the bigger picture
Yeah.
and not just focus on occupation by occupation. You need to look to see how these occupations interact with each other and kind of plan accordingly. Also knowing that positions like MAs and CNAs and stuff are somewhat high churn. It's kind of designed to be that way. The training programs are usually fairly short, usually less than a year, pays low, um, and so they come in and out of those jobs a lot. In fact, when I first started here in 2016 and was looking at numbers, there were about 18,000 CNAs. There still are about 18,000 CNAs. It has been super, super stable, even with super high numbers of churn. I know a lot of CNAs who went through training, got licensed or got certified, and then are no longer CNAs or doing something else right now. So those kinds of jobs. But what's really important is to know that it isn't just about not enough nurses. Although in some instances it is just about nurses, but generally it's not. It's about the shortage or the lack of people filling some of these occupations that are in support roles or in primary provider roles that also impact the workload of the nurses. It is the some and most of this, a lot of this stuff is based on systemic failures or systemic issues within healthcare. Um, and so that also has a role that has really, it's not a failure of nurses or of nursing. It's kind of a feature built into the healthcare system. Um, and so these things can be used to advocate for increasing the number of CNA training programs. Um, we're seeing more LPNs in long-term care facilities than we used to. As we look to, we just got some new data about 5 or 6 months ago that we're finally able to sit down and really analyze. And we have more CNAs in the hospital than not. And most of the LPNs are working in long-term care rather than in the hospital. So it kind of depends on what setting you're working in, depending on what kind of occupations. But this gives you an idea, or at least a framework, that when you're starting to do some workforce planning and policy to that matter, is you need to look at the whole constellation. And this gives you an idea of where those investments ought to be. And we do have some time. We were worried about yesterday when we ran, or Wednesday, we ran through a little practice and acknowledged that all three of us can fill, are like gases. We fill every available second. So I'm actually kind of happy that we got done a little early
We
so we
got
wouldn't
through
have to
all of
talk.
that. Okay, but that's which is good, Rick, because we do have some questions in the chat. So we're going to
Yeah.
start. Tom, I see you. We're going to get to you in just a second. We're going to start with Mary's question in the chat. Rick, you started to talk about CNAs. Did you have anything else to add?
No.
Okay. And Mary, maybe if you wanted to, if you want to put into the chat a little bit more about what you were hoping for or what you were
No, he
looking
just
for.
didn't finish his thought before, but now he did.
Oh, okay. So
Yeah.
yeah, so that's all taken care of.
Okay.
Beauty. Okay, let's go to Tom with your hand up. Go ahead, Tom.
Rick, thanks. I'm always cautious about papers that have rankings that don't show us what the measure of centrality is for each of the elements and doesn't show us the deviation. Because as you know, you can have a something ranked number 3, but if the deviation is from here to Montreal,
Mhm.
and overlaps with the deviation of something else, you really can't say that one is ranked lower or higher than the other without those measures of deviation. So I I worry that we overinterpret rankings, but I don't
Mhm.
Yeah,
worry that we overinterpret the discussions. Because again, without the measures of centrality and the measures of deviation, we really don't know statistically if a ranking is actually really indeed higher or lower than another one.
correct. That
So
generally that is correct. That's absolutely right, Tom.
I, I worry that, we can say that, oh, magnetic resonance imaging technologist is
Hmm.
turnover is 13, so it's ranked differently than nurse practitioner. But for all I know, the MRI deviation is again from here to Montreal, so you really can't say they're different. They're the same, maybe.
Well, yeah, I mean,
You
in some
can't.
instances, that's true.
Well,
But in this case, since we're looking at each one independently, looking at market pressures, this isn't evaluation of the different occupations. This also isn't ranking importance. So it's not
well,
really on a scale that is.
but you're saying that the whatever the rate is that's in that MRI and the rate
Mhm.
that's in NP, those are two rates. But if the deviation is broad and overlaps, you can't say they're different.
I'm not saying they're different.
Okay.
This is not
Well,
making
that's what I
any.
worry about when
Well,
people
yeah,
talk
but
about the rankings is they think
well,
that somehow
well,
it's
you have to rank them somehow you have to distinguish between a high wage, low turnover job and a low wage, high turnover job. And the easiest way of doing that is by having a marketplace ranking.
And I think, Tom, we're comparing them to each other as opposed to going through and trying to figure out, well, what's the
Right.
turnover? Yeah,
But
we're trying to like take this one sample of the people that are working in these healthcare occupations so that we can understand how that looks there.
right. So we're not comparing them to each other, we're comparing them to themselves.
Mm,
And the nice thing about it, if you want to go look at the distribution of wages, you can go look. The data are publicly available. And in the paper, we cite it, and you can go look at it, and you can see where
mm,
it is. And in reality, it does move a lot. Nurse anesthetists are paid very, very well, 4 or 5 times what a CNA makes.
mhm. All right, thanks, Tom. Carrie Norris put in the chat, what proportion of turnover in support roles is explained by folks moving on to RN?
That is unknowable. The
Mhm,
data are really just turnover ranks on themselves. Now we do know through other work that a lot of CNAs go on to nursing school to become
mhm,
RNs. We know that just because I think what was it about 40%, Jana,
mhm. Yeah.
said that they were in the process of applying for or were already accepted into nursing schools. And this was before the pandemic. This was in 2017 or 2018. We did that work for OSPN.
Mhm,
So I'm sure some of it is there is, especially in the low churn jobs where or the high churn jobs where there is high turnover rates, people are moving on to other roles within healthcare. It's not like they'll go do, although a lot of people go do other things, but we do
mhm.
see folks moving from CNAs and LPNs into um, into the RN ranks.
Very good. Okay, and Jesse Mensa Kennedy put in the chat, is this inclusive of all employment settings?
Yes.
Yeah, I thought so.
Now it is a little restrictive on nurses because
Mhm,
it only includes nurses that really fit the title of a staff nurse. That's
mhm.
broad. So like nurse educators, nurse administrators, this is based on occupation codes.
Yeah.
So folks that are actually serving as staff nurses, floor nurses, those get counted as registered nurses. Nurse educators that we think of as nurses from the employment department's eye, they're educators.
Mhm.
So that's a little bit of a caveat there.
Yeah, thank you. Kate Whalen put in the chat something that's reflecting what Carrie Norris said, where she said some of those CNA, MS, and phlebotomists have gone to school to become a nurse. And I think that that goes to the turnover.
Yeah,
Yeah, the turnover doesn't mean that they hate their jobs necessarily. The
yeah,
turnover is because that for a lot of people, that's the stepping stone into
right,
higher positions
right,
into the healthcare industry.
correct.
Yeah, and then Kate and Carrie, Mary Dakin said that it's a 2 to 4 year training leap, so it's hard to measure. Yeah, we run into that as well.
Yeah.
Yeah, Holly says, I do think it's important to emphasize that based on what Rick just described, the ranks of it, these ranks are independent of each other and not a comparison. And
Correct.
I may have said that wrong, so let's go with what Rick said because he is our researcher. Yeah,
Yeah. Yeah.
they're these ranks that and honestly we really were shying away from calling it a ranking. I think that in other there's another state that does something similar in their state. They call it a ranking, and we don't call it a ranking because it isn't that this occupation is better or more important than
Right.
these occupations. It's
Right.
really just a score. We're just looking at
Right.
their
Right.
at these
Right.
variables independently.
Right. Right. Yeah. We calculated them each one independently of each other. They are not dependent on each other in terms of the raw numbers that base these rankings, but you have to have some way of comparison. And
Yeah,
again, this is not ranking, or this is not making an evaluation statement. This is not judging the importance of an occupation. This is really just looking at the impact of labor market pressures on those occupations.
exactly. Meredith put in the chat, did you look at the relationships between the individual measures? For instance, is there a correlation between wages and turnover? Because that would be interesting to see and could also help guide policy.
Um, well, you can just look at the ranking and you can see the correlation. So yes, these measures are correlated to
Mm-hmm.
some degree.
Mm-hmm.
Shortage and turnover are intimately correlated, growth not so much, but wages do correlate back with turnover.
Yeah, you can see that by the
Mhm.
numbers. The numbers of
Right,
the lower numbers mean that they have higher wages and lower turnover, and the higher numbers mean that they have lower wages.
right. So
And
for instance, look at the nurse practitioner, which is the fourth row.
yeah.
It has very high growth
Mm-hmm.
with that really low ranking, very low turnover. Could you I can't read it with
Oh,
it
sorry. I
highlighted.
was
No
like
worries.
thinking
Very
I was thinking I was doing something good for you, but not. Sorry.
No, I couldn't see it anymore. It all turned blue. Um,
Mm-hmm.
really low turnover, fairly high wages. But look at the shortage. It's got some of the largest shortages of all the occupations we looked at. And that's more to do with the time it takes to train
Mm-hmm.
and how fast that industry is growing for nurse practitioners. So, but overall, it still has a very low ranking.
All right. Okay, Holly put in the chat, it would be useful to have those statistics as part of this document. This document is the last page of a whole report that kind of gets into those statistics. So
Right. And
go
if
to
you
the
want to
link.
look,
Yeah.
all that data is available. It is a
Mhm.
lot of data.
Yeah,
Um,
exactly. Yeah,
so
and
so that's all available to look at. And if you want to talk about it, we can definitely do that offline.
yeah, we can also, yeah, we're available to talk about this and answer individual questions. Jesse put in the chat, most of the people I graduated nursing school with have become nurse coaches, independent private nurses, or nurse educators, or nurse estheticians. It's incredibly difficult to track nurses who are not in the hospital setting, which I think is a disparity between licensed RN and position vacancy, as many RNs don't want to work in the hospital. We have other
Right.
data about that, maybe not necessarily in this particular ranking, but in
Yeah.
our,
And one of the
yeah.
and Jen and I talked about this a couple weeks ago.
Mhm.
So I've always seen about half the registered nurses practice in a hospital setting.
Yes.
And it was coming down until the pandemic, and now it's going back up. So I think we're at about 56%
Mhm.
of RNs working in. I'm looking real quick. Yeah, 54%, which is up a little bit. It's not great. It's not a huge number. It's not a big increase, but it's trending in the opposite way that it was a couple years ago.
Yeah. And the whole time that I have worked at the Oregon Center for Nursing, the largest setting, the largest amount of nurses work in a hospital setting. And the number two setting where nurses work the most in is other. Really, it's just other. And that is because of exactly what you're describing. It's like they're working as coaches, they're working as
Hmm.
private nurses, they're working as estheticians,
Right.
they're working in all of these kind of onesie twosie little areas. And it is very, very hard to track all of those different places. I wouldn't say that many RNs don't want to work in a hospital. I think that any of our educators that are here will tell you that nursing students generally do want to work in a hospital. But nursing is such an absolutely wonderfully diverse career where with your nursing license, you can work in a myriad of different places. And so that just means that trying to track where every single nurse is going is a little bit tricky. So
Yeah,
you
and
kind of
I
hit,
saw a
hit it
couple
on the
more
nose.
comments from Jesse, and I just
Yeah,
want to say, I just want to make sure that people understand there are limitations to these data. The employment department doesn't consider setting. It
yeah,
considers your job description and that occupation code. So if you fit that description, that's where you get placed. It doesn't matter if you're working in long-term care, school
mhm,
health, whatever. If you're doing the job that looks like a staff nurse based on job description and a job audit, that's the occupation you get assigned, and that's where you get placed. So
yeah.
it is silent against setting, but it mainly looks at the functions of the job.
Yeah, thank you. And that has to do with how the Oregon Employment Department tracks their data. And before people start to think, well, let's get them to change the way they do it, it's kind of best practice. What they're doing right now is best practice and how it's
Right.
tracked in other states. And that's part
And
of the
at the
reason why
federal
we do
level.
independent studies a lot, so we can make
Right.
sure that we get that, capture that.
All right.
And then finally, George says, I hope OCM will be following up at some point to see how recent student education loan program changes impact these numbers. That's actually why we did this. We wanted to start getting this baseline because as things are going to be changing over the next few years, it will be really interesting to see,
Mm-hmm.
do these scores change? Is there
Mm-hmm.
going to be an increase in turnover in some areas that we didn't anticipate? Is
Right.
that going to be because of student loans? Is that going to be because of other things? It really is. We wanted to get this as kind of like, all right, let's do this now before all of these policy changes start to filter down into the nursing community so that we'll
Yeah.
be able to explain it a little bit better as we see things changing.
Yeah.
All right.
Cool.
I think that is it.
Yeah. So thank you all very, very much. As with all of our extended cuts, this has been recorded and will be posted sometime this afternoon, tomorrow, or Monday, or something like that soon.
Very soon. And
Yeah.
if you have any individual questions, if something you're in the shower and something comes up and you think about it, jot it down, send us an email, and we will get back to you just as quick as we can. So thank
Yeah.
you, everybody, for taking the time to come and chat with us a little bit about this research today. And we hope you have a wonderful holiday season. And we'll talk to y'all soon. Thank you.
Thank you all very much.